Now we'll move on to the topic natural methods of contraception. So, this natural methods of contraceptions are those things where we avoid pregnancy without any use of drugs, devices, or surgery. So it is like a contraceptive method where we don't use any kind of drugs, or like internally like oral pills and all, or any other devices like IUDs and all, or any surgery. So this is the natural methods of contraception. So these methods are based on a woman's menstrual cycle. So based on the understanding of menstrual cycle and the fertility awareness of the women, we'll do this natural methods, and they are very when you relate this natural methods to the other type of methods of contraceptives, these are kind of safe, cost effective, and have no other side effects, but they are less reliable compared to the modern methods. So that is the intro of natural methods. Now we'll move on to the types of natural contraception. So there are five types of natural methods. One is calendar, or we'll call this a rhythm method. Second is basal body temperature method. Third, cervical mucus, or we'll call as Billings method. Fourth is lactational amenorrhea method, LAM. And the last one is coitus interruptus, or the withdrawal method. So, talking about the calendar or rhythm method, avoiding intercourse, what we'll do here is we'll avoid intercourse during the fertile days calculated from the cycle. So, based on the menstrual cycle, the calendar method, based on the menstrual cycle of the women, we'll decide the calendar method. Second is basal body temperature. So basal body temperature, the method here is here identifying the safe days by checking the daily morning temperature. So the temperature of the women will body temperature of the women will be checked in the early morning. So based on that, they'll do. Then the third is cervical mucus or Billings. So here the method is observing the changes in the cervical mucus to identify the fertile days. Like you already know, on the fertile days, there will be changes on a normal woman during the fertile days. There will be a changes in the cervical mucus. So by observing the changes in cervical mucus, the couples may it will be helpful for them to identify whether it is a fertile day or not. So based on the changes in cervical mucus, they you can that is the type of natural contraception. Fourth is lactational amenorrhea method, or LAM. So it is exclusively breastfeeding in the first 6 months. It prevents the ovulation. So during the first 6 months after the pregnancy, during the lactational time, it will prevent the ovulation. So during that, that is one of the type of natural contraception. And fifth is coitus interruptus, or the withdrawal method. So here the withdrawal method, the male partner withdraws before the ejaculation. So during the intercourse, the male partner will withdraw the before the ejaculation. The male partner have to withdraw it. So that is the another last type of natural contraception. Next is the clinical importance. So what are the clinical importance of natural methods? So natural methods are important in certain clinical situations. They are very useful for women who want to avoid hormones, or any have a contraindications to hormonal contraceptions. So they also give patients kind of a better awareness of their reproductive physiology. So one thing is the effectiveness depends heavily on the compliance. So missing even a few days of discipline can lead to a failure. So that is it is good, but the thing is, if there is any missing days, or like if, for example, whenever you are doing the sexual intercourse, so during any time of that, if you miss any one or the day, if for example if you're doing the calendar method, rhythm method, so during the fertile days, like if the patient's having irregular periods and all, if the women have irregular menstrual cycle, you will not be able to find the like particular day, fertile day, in case of calendar method. So in those cases it may be a failure. So natural method is good, but the thing is missing even a few days can lead to a failure. So that is one drawback here. Next is the OPD management, IPD management. OPD in the outpatient setting are as a clinician, as a doctor, our role is mainly on counseling and education. So we should explain the fertility awareness clearly to the couple whenever they are planning to do a natural contraception. Teach them how to use the calendar charts, mucus observation, and basal body temperature recording and all. Educate new mothers about the lactational amenorrhea, but also tell them the criteria for it to be effective. Next is the you have to emphasize the need for motivation and strict compliance, and always discuss the failure rates and advise the backup methods if needed. So these are the important things you have to do when the patients come to you for the like whenever when you advise them for to do a natural contraception. You can advise all these things is very important when the patients or the couples come to you in the OPD. So this is how you have to manage the things in the OPD level. Moving on to the IPD level. So in the inpatient setting, in the IPD level, the natural methods were rarely used. So the main role here is postpartum counseling, LAM educations. So after the pregnancy, after the delivery. So before a mother or the women discharged, you should be able to give reproductive health education, including when to switch from natural to more reliable contraceptive methods. So this is the important point you have to do in management when the patients or couples come for you in the IPD level. So whenever patient discharge after the delivery and all, you can advise them and have give them a proper educations regarding the natural methods and important postpartum counseling too. So this is what about the natural methods. So here natural methods, so keep on mind, natural methods rely on the fertility awareness and during the fertile days. The common methods, as I've discussed, rhythm, basal calendar or rhythm method, basal body temperature, cervical mucus, LAM, that is a lactational amenorrhea, and lactational amenorrhea method, and the last one is, as I've mentioned, withdrawal method. So they are safe and free of side effects, but need a discipline and consistency. So in clinical practice, these methods are best managed in the OPD through patient education and counseling. So usually this comes in the OPD levels. Whenever IPD management, you most of the time the lactation amenorrhea method, you have to educate the patient and educate the woman after their discharge of delivery. So this is what about the natural methods.